Have you ever pondered about the inner workings of your body each time you engage in masturbation? Many men are unaware that their prostate undergoes immediate and long-term changes before and after ejaculation. Surprisingly, some of these changes can be advantageous, while others may be worrisome if disregarded. In this video, we will delve into 6 crucial changes that occur in your prostate during masturbation, ranging from blood flow and hormonal shifts to potential effects on long-term prostate health. These alterations play a vital role in the aging process of your body. By comprehending these changes, you can make informed decisions concerning your health, habits, and future well-being. Make sure to stay tuned until the end, as you will not only learn about the effects of ejaculation, but also understand how these changes impact your prostate over time. These insights might alter your perspective on your body and even aid in preventing serious health complications in the future. Let's begin with the first point: the impact on prostate cancer risk. The association between masturbation and prostate health has been a subject of debate, particularly regarding its potential role in reducing the risk of prostate cancer. Numerous studies have suggested that regular ejaculation may help eliminate carcinogens and inflammatory agents from the prostate, thereby potentially decreasing the risk of developing prostate cancer later in life. The rationale behind this is relatively straightforward. The prostate gland produces seminal fluid, which can accumulate toxins, metabolic byproducts, and excess hormones over time. Failure to expel these substances regularly may lead to cellular damage and inflammation, both of which are linked to an increased risk of cancer. Some researchers believe that frequent ejaculation can flush out these harmful substances, maintaining the prostate in a healthier condition. For instance, a renowned study by Harvard researchers revealed that men ejaculating at least 21 times per month had a significantly lower risk of prostate cancer compared to those ejaculating less frequently. While this does not imply that every man needs to reach a specific number, it suggests that a consistent pattern of ejaculation could benefit prostate health. Nonetheless, it is crucial to recognize that ejaculation is just one piece of the puzzle in prostate cancer risk. Genetics, diet, lifestyle, and overall health also play significant roles in determining the risk of prostate cancer. To illustrate, let's consider James, a 74-year-old man with a family history of prostate cancer. Concerned about his risk, he researched methods to enhance his prostate health. He discovered that maintaining an active sex life, along with proper nutrition and regular checkups, could reduce his overall risk. After consulting his doctor, he made simple yet effective changes, such as increasing ejaculation frequency, consuming cruciferous vegetables, and following an exercise routine to support hormone balance. Over time, he noticed improvements in his well-being and felt more confident about his health. Despite the potential benefits of ejaculation, it is essential to understand that it is not a foolproof method to prevent prostate cancer. It should be viewed as one of many lifestyle factors contributing to prostate health. Maintaining a healthy diet, managing stress, staying physically active, and undergoing regular prostate screenings are equally, if not more, important. Moving on to the second point: temporary reduction in prostate congestion. One of the lesser discussed advantages of masturbation is its ability to alleviate excess seminal fluid accumulation in the prostate. This process, known as prostatic drainage, plays a crucial role in preserving prostate health. When you ejaculate, the prostate releases accumulated fluid, reducing internal pressure and potentially decreasing the risk of discomfort and inflammation. For most men, this results in a sense of relief and relaxation post-ejaculation. However, for those who ejaculate infrequently, this buildup can lead to temporary congestion, causing mild pelvic discomfort or an increased urge to urinate. This scenario is particularly relevant for men with benign prostatic hyperplasia, BPH, or chronic prostatitis, where stagnant fluid inside the prostate can provoke irritation. Consider Richard, a 72-year-old retiree who had abstained from sexual activity for months. He began experiencing a dull ache in his lower abdomen and frequent nighttime urination. His doctor attributed this to mild congestion in his prostate due to a lack of ejaculation, resulting in heightened inflammation and pressure on his bladder. To his surprise, the doctor suggested regular ejaculation to alleviate the buildup and improve his symptoms. Following this advice, Richard observed a significant reduction in symptoms. Experiencing less discomfort and fewer nighttime trips to the bathroom does not necessarily mean that all men must adhere to a specific frequency, but it does emphasize a crucial point. Ejaculation can serve as a natural method to alleviate prostate congestion. However, if discomfort persists even after ejaculation, or if relief is only temporary, it may indicate an underlying issue that requires medical attention. The key takeaway is that for many men, moderate masturbation can offer a simple way to support prostate health and reduce unnecessary discomfort. If you are still watching this video and finding these insights valuable, please leave a comment below to let me know you are here. If you have not yet subscribed, I recommend doing so and turning on the notification bell to ensure you do not miss any future videos. Your support enables us to keep producing informative and inspiring content. Now, let's delve into the topic of hormonal shifts in testosterone regulation. When you masturbate, the levels of hormones in your body, particularly testosterone and dihydrotestosterone, DHT, fluctuate. These hormones play vital roles in prostate function, muscle strength, and overall male health. While testosterone naturally fluctuates throughout the day, sexual activity can cause a temporary drop in its levels immediately after ejaculation. This drop is usually barely noticeable in younger men as their bodies quickly replenish testosterone. However, as men age, testosterone production naturally decreases, and frequent ejaculation can lead to temporary dips in energy, motivation, and muscle recovery. This temporary decrease in testosterone levels is short-lived, and in most cases, levels return to normal within 24 hours. DHT, a potent form of testosterone, is crucial for normal male development, but excessive levels can contribute to prostate enlargement and hair loss. Some studies suggest that frequent ejaculation may help reduce DHT buildup, potentially lowering the risk of benign prostatic hyperplasia, BPH, over time. However, maintaining the balance is crucial as too little DHT can affect libido and vitality, while too much can contribute to prostate issues. Consider Frank, a 68-year-old who had been feeling unusually fatigued and experienced a decline in energy levels and motivation. By adjusting his habits, including better sleep, strength training, and a nutrient-rich diet, he was able to restore his energy and maintain a healthy hormonal balance. For most men, these hormonal shifts are not a cause for concern, but it is essential to be aware of them as you age. Understanding the roles of testosterone and DHT in your body can help you make informed choices about your habits and overall health. If you notice persistent fatigue, low libido, or changes in muscle strength, discussing hormonal balance with a doctor may be beneficial. While masturbation itself is not harmful, moderation is key to maintaining healthy hormone levels and supporting long-term prostate health. One of the initial responses when you masturbate is a surge in blood flow to the prostate. This increase in blood flow is a natural response during sexual arousal and supports the prostate gland's function in producing seminal fluid. While this process typically occurs without discomfort for most men, those with an enlarged or inflamed prostate may experience temporary swelling and pressure in the pelvic area. This can result in a feeling of fullness or mild discomfort after ejaculation, especially for individuals with conditions like BPH or prostatitis. Take George, for instance, a 74-year-old man who had been dealing with mild prostate enlargement. Although it was not a significant issue most of the time, he began experiencing a dull ache in his lower abdomen after ejaculation. Initially ignoring it, the discomfort persisted, making it challenging for him to sleep. Upon consulting his doctor, he learned that the increased blood flow during sexual activity was temporarily inflaming his already enlarged prostate. The doctor reassured him that moderation was key in managing his condition. Ejaculation continues to be beneficial, with the addition of recommendations for hydration, dietary changes, and pelvic floor relaxation exercises to alleviate post-ejaculation discomfort. While temporary swelling post-ejaculation is typically normal and part of the body's blood circulation regulation, prolonged discomfort, difficulty urinating, or lingering pain should prompt a doctor's visit. Masturbation itself does not cause prostate issues, but underlying conditions like BPH or prostatitis can exacerbate after effects. Being attuned to your body's reactions can aid in making informed health decisions and avoiding unnecessary discomfort. If you are still following along and finding these insights useful, please comment with the number 4 below to indicate your presence. If you haven't subscribed yet, I encourage you to do so and enable notifications so you don't miss any future content. Your support enables us to continue creating informative and inspiring material. Now let's delve into the impact on urinary function, particularly in older men. Urinary health becomes a significant concern for many aging individuals, and masturbation can affect urinary system functionality. The proximity of the prostate to the bladder and urethra directly influences urinary flow, urgency, and frequency. After ejaculation, the prostate contracts and relaxes, potentially leading to increased urinary urgency, especially in cases of prostate enlargement. This is particularly pertinent for men with BPH, where an enlarged prostate can impede urination. Some individuals may notice a weaker stream or increased frequency of urination post-ejaculation due to readjustment in bladder and prostate muscles after sexual activity. Consider Robert, a 70-year-old experiencing heightened nighttime urination. Initially attributing it to aging, he discovered his slightly enlarged prostate was affecting urinary control. Observing a pattern of increased urgency and weaker stream post-masturbation, he adjusted his hydration, minimized caffeine and alcohol intake, and monitored symptom occurrence. With time, he managed his urination patterns more effectively, improving his quality of sleep. However, for men without significant prostate enlargement, masturbation can relax pelvic muscles and enhance urinary flow in the long term. Some urologists even advocate periodic ejaculation for maintaining prostate flexibility and reducing inflammation. Monitoring bodily signals is crucial. If urination post-ejaculation becomes increasingly challenging, medical attention may be necessary. While masturbation can impact urinary patterns, its effects vary based on prostate health, hydration levels, and overall lifestyle. Any changes in urinary function linked to sexual activity should be discussed with a healthcare provider to determine normalcy or potential issues requiring evaluation. Maintaining a balance in hydration, exercise, and prostate care can support stable urinary function with age. Moving on to circulatory benefits, masturbation influences blood circulation, particularly in older men. Engaging in sexual activity elevates heart rate, expands blood vessels, and improves oxygen-rich blood circulation, akin to light physical activity. For individuals with heart conditions, high blood pressure, or circulatory ailments, the effects of masturbation may vary. It can act as a natural stress reliever, relaxing blood vessels and reducing blood pressure in the short term through the release of nitric oxide. Regular sexual activity may even aid heart health by reducing stress-related inflammation and enhancing circulation. However, individuals with underlying conditions should be mindful of how masturbation affects their circulatory system. In conclusion, masturbation can have diverse effects on blood circulation, providing cardiovascular benefits for some individuals. It is crucial to understand how sexual activity impacts your body, particularly in the context of pre-existing health conditions. Regular monitoring and seeking medical advice when necessary can help maintain a healthy balance in all aspects of life, supporting stable urinary function and overall well-being as you age. If you experience dizziness, chest discomfort, or irregular heartbeats following ejaculation, it may be a sign of an underlying cardiovascular issue that requires medical attention. Consider the case of Alan, a 73-year-old who led an active lifestyle but began experiencing occasional dizziness after climaxing. Initially dismissing it as insignificant, he eventually sought help from his doctor, Tess. It was revealed that his blood pressure would slightly drop after sexual activity, leading to his symptoms. By making adjustments to his routine, such as staying hydrated, making dietary changes, and spacing out intense activities, Alan was able to enjoy a normal sex life without worry. On the other hand, poor circulation can contribute to erectile dysfunction, ED, a common issue affecting many men over 60. Reduced blood flow can result in a weaker or delayed erectile response, indicating vascular function problems. Proper blood circulation is crucial for achieving and maintaining an erection, and any issues such as high cholesterol, arterial stiffness, or diabetes can impact sexual health. Some medical professionals even consider erectile performance as an early indicator of heart health, underscoring the importance of addressing changes in sexual function. While masturbation alone may not significantly improve circulation, it can be a part of an overall strategy to maintain cardiovascular wellness. Paying attention to your body's signals is key. If you experience dizziness, fatigue, or unusual heart palpitations after ejaculation, it is advisable to seek medical evaluation. Heart health and sexual health are closely linked, and managing factors like blood pressure, cholesterol, and circulation can benefit both areas. Reflecting on the information presented in this video, consider how these insights may apply to your own health and well-being. Understanding the natural changes that occur in our bodies over time empowers us to make informed decisions for our health. Remember that moderation is key in all aspects of life, including sexual activity. Making adjustments based on how your body responds can contribute to a healthier and more fulfilling lifestyle. If you have any concerns about your health, do not hesitate to seek medical advice. Your well-being is paramount, and it is important to address any issues promptly. Share your thoughts and what you have learned from this video in the comments below. Your feedback is valuable and encourages us to continue creating informative content. If you found this video helpful, please like, subscribe, and share to support our efforts in providing valuable information. Thank you for watching, and we look forward to engaging with you in our future videos.